backing up, the majority of patients who are diagnosed with low-risk prostate cancer and some select patients with favorable intermediate-risk prostate cancer can be selected for active surveillance. However, adoption in the U.S. has been it's increasing, but still fairly low. And so, looking at genomic features associated with adverse pathologic features for those patients who are considered active surveillance eligible, but actually underwent surgery is kind of one of the surrogate markers that we can use to help better select patients who should go on active surveillance. So I mean, I think one of the main things that has, to some extent limited uptake of active surveillance is, limited number of risk stratification tools. And so, genomics, and specifically the Decipher product, as well as other biomarkers such as Artera AI, they help inform which patients are likely to do best on active surveillance. We identified 112 patients who underwent radical prostatectomy at Northwestern. Our selection criteria were NCCN risk, very low risk to favorable intermediate risk prostate cancer, which again are typically the criteria for entering active surveillance. We then saw which patients had adverse pathologic features, and this is defined by grade group 325, PT3B or seminal vesicle invasion, or node-positive disease. And we identified about 30% of patients who had one of those features. If you look at the baseline clinical variables, we saw that a higher total PSA was associated with adverse pathologic features. And then also, interestingly, a lack of preoperative MRI was associated with adverse pathologic features. When you look at the genomics, we found that the Decipher product was associated with adverse pathologic features, and it's kind of been debated in literature as a utility, but we did find that there was a signal for Decipher. And then we found that there were some other genomic signatures, such as PTEN loss and also activated CD4 activity that were associated with adverse pathologic features at radical prostatectomy. PTEN loss has been described previously in the literature to be associated with more aggressive prostate cancer, typically more like advanced or metastatic cancer. So, one of the great parts about Decipher is that they're currently making like a transcriptomic Decipher grid. So there are all sorts of molecular markers that we could look at for utility down the line to help better select patients for active surveillance. As for the activated CD4 count, I think it's primarily hypothesis generating. But, I guess looking into the tumor microenvironment and specifically the, immune cells around the prostate cancer may help, both identify new biomarkers as well as, new targets for therapy. So, yeah, it's really exciting. And I think the next step is really incorporating genomics into active surveillance trials. And then again, looking at different potential biomarkers. As I mentioned, these are patients who are active surveillance eligible who went on to surgery, but our next step is to design a prospective trial for active surveillance, evaluating various biomarkers such as Decipher, but also Artera AI, which is a digital pathology multimodal AI model. So we're going to be incorporating all of that into the trial just to see, what can help our patients best select the ideal treatment option for them.